To read and write, essential skills for living in today's world. Literacy, the ability in the calculations, reinforces the self-esteem, contributes to the tokenization and educational success, improving the perspective of health, employment opportunities, and reduces mortality in Africa. Wake Up Africa, the non-government organization, is assigned the duty to help the people of Africa with sustainable social welfare. It intervenes particularly in the field of health, education and development so that Africa can stand up again. Wake Up Africa. To live is also adding one more thing to our fellow men. Work in perilous roads in Africa in order to help people. It is the heavy task which that moving team composed sometimes of doctors, researchers, university professors, general managers and young professionals is carrying out. Young but dynamic, the members of the NGO Wake Up Africa have understood that Africa needs first them to raise the great challenges of development. They have decided to put in the service of Africa their competence and expertise. It is in Ivory Coast that the headquarters of NGO Wake Up Africa is located. It is a strategic choice of these NGOs in West Africa. The country has 60 ethnic groups. Ivory Coast is a secular country where several denominations live together, whose the main ones are Christianity, Islam, and animism. Like many sub-Saharan African countries, Ivory Coast is a country with political instability since a decade. It has been long aware that unstable country knows flaws in public health, education, and employment. This fact has allowed the NGO Wake Up Africa to implement, monitor, and evaluate effective strategies to reduce significantly the poverty, the mortality rate in Ivory Coast and in any other African countries. The example of Ivory Coast is the case of learning. Although African governments are making effort to help their people, means are often insignificant. In accordance with the objective of Millennium Development Goals, it is in this framework that the NGO Wake Up Africa provides support to African teams in terms of development of public health, education, and integration of young dropouts or unemployed.
I'm convinced that the NGOs, which are not profit-making organizations and which are neither governmental organizations, that is to say, governed by a political structure which is always very complicated in Africa because of crises we have in some countries. I think the NGOs in general could first allow helping in providing major support to Africa. We have several kinds of activities. We have taken the challenge of moving ourselves towards the medical side. Let's say that the next activity, like the present ones, is moving towards the medicine.
Poverty gangrenes African societies. Today, an African over two cannot heal oneself properly when he is sick. We are in Korogo in northern Ivory Coast. Here, as elsewhere, these kiosks selling Chinese medicines are in all street corners. The instructions for use of these drugs are in Chinese. It is therefore difficult for a patient to read them. When we know that in Africa the main spoken and written languages are English and French, it is difficult to sell those medicines products in the countries which do not speak Chinese. In this kind of situation, the only credibility relies on only words of these sellers who sometimes are unaware of the name of the product and cannot provide adequate dosage. That woman speaks Jula, a trade language spoken in Ivory Coast. As shown in the picture on the bottle, a little bent man manifests pain in the abdomen. It is often through this imaged sign that these sellers recognize the curative purpose of these drugs. In recent years, Indian and Chinese drugs have flooded the African market. People find the cost of medicine in pharmacy too exorbitant. These women you see are selling in pharmacy. They recommend the dosage of these drugs in their local language. Some are hawkers, others in the other side establish their trade at crossroads and even sometimes in front of certain pharmacies. These drugs exposed on the sun are sometimes outdated. We do not often have a choice when we know that the pockets are empty. The importance for many buyers is to calm down the pain of which they are victims. The consequences are sometimes cumbersome because they lead to incurable diseases in some patients.
Growing impoverishment of the population in Ivory Coast so that even if the drug is available, it is not easily accessible to the people because they don't have the money to buy it. Especially in the medicine domain, the first major challenge is the fight against drugs in the street. The fight against illicit trafficked drugs, counterfeit drugs, smuggled drugs, drugs are that not of good qualities and which either don't heal people or make worse the health because it poisons the population. So it could be very important to succeed in the fight against because these drugs instead of killing people.
African people are suffering in rural, urban and suburban. The social-political crisis occurred in September 2002, caused the bad function of the health system in Ivory Coast and a resurgence of health problems in the country. The NGO Wake Up Africa is committed for 2 years to help the people of northern Ivory Coast, starting by Bouaké, the town situated in the central of Ivory Coast. Mr. Dibi Kwaku Florent, a doctor specialized cardiologist, he is halfway between Europe and Africa in order to establish telemedicine in Ivory Coast and in other African countries, but also to bring to the eyes of everyone the importance of helping the African people worn by poverty. Here is the clinic Semchik of Dar es Salaam in Bouaké. As you can see, patients are waiting to be consulted when Dr. Dibi is present. Bouaké has no specialist in cardiology since the crisis started in 2002 in Ivory Coast. Today he is busy. Many patients welcome his presence. They can be consulted. He was able to train some health agents to the use of electrocardiogram to deal with complicated situations when he is not present. Today, he himself is present to interpret the results of his electrocardiogram record. In France, he interprets via internet his electrocardiogram records, which are scanned and sent in his electronic mailbox attached to his files.
At the political level, as it's the case for Ivory Coast, and well, we have witnessed against to a moving of the population towards the south in general areas, but it is always the specialists, health professionals who were there in these domains, at the villages, in the sub-prefectures, in the departments. There has been also a movement of these populations to preserve their lives. Conditions are no longer met serenity in these areas. People went to the most secure areas in the south, thereby increasing the concentration of physicians and health professionals in these areas to the detriment of these areas which were already disadvantaged. With the various agreements that have been signed, a significant part of the population has returned to its place of residence because that population was facing integration problems, so most are left to their original place. So in the domain of health professionals, we have hospitals that are not rehabilitated because they were looted during that crisis period. And there is the problem of lack of hospital practitioners, health professionals, because people are still skeptical even concerning the stability of the country and are still reluctant to return to their original positions where they have lost of the goods of materials. So there is every political of redeployment, of remobilization to be done in order to restore against the delicate balance that it was. And the crisis has accentuated that disparity.
He started his activities with the mobile medical team in Muslim community. In the beginning, it was within the cardiology consultations concerning the departure of Muslims to Mecca. There, he noticed that the people have a lot of health problems, most often linked to poverty. Today, he travels with his team throughout the north of Ivory Coast to help the populations at risk. The people of northern Ivory Coast do not have the means to go to the best equipped hospitals in Abidjan, the economic capital.
He's a man who has been sick for a long time. He heard that today it would have the cardiologist moving team who will come then on the recommendation of doctors in the area. He has come in our local and fairly quickly through ultrasound, and the signs which he showed were able to make a diagnosis, and especially doing what it is interesting, what is indicated in the case, which is to do the puncture.
This patient is reassured. Dr. DB is present today. This patient can live through the intervention. Here is what we removed from his chest. After the puncture, Kwasi feels much better. He will join his village, his 4 wives and his children. Another life is saved.
With the war that Ivory Coast is experiencing since 2002, these populations are struggling to go to health centers. And when they go there, they are struggling to pay health care and beyond that, prescriptions which are given to them. People are unable to cope with the prescriptions due to financial problems. So there is first the geographical accessibility and then financial accessibility, as well as cultural accessibility. Because of the cultural level, we can see that people are accustomed to use alternative treatment instead of using modern treatment, which causes the problem in the management of diseases in Ivory Coast.
The health center in the country is under-equipped and has a screaming deficit of specialists. Despite the efforts of the Ivorian state, people suffer.
Seeing the large number of patients that we have, seen that the NGO does not have great means, the initial material has more or less taken a cost. So we can ask through this interview a call for other partners, other backers to support us in medical equipment in order to provide quality services to the population.
What are the adequate means to solve this situation? While the African people die, what are the options for a stopgap? Health centers are crumbling. People are anxious for the future. The picture that is presented is dark.
The drastic reduction of the technical platform in our hospital is doing that there are certain activities that we can no longer carry. Activities we did before. You go into emergency sometimes, there is not the minimum. So there are students in training, doctors in training who come to learn because the technical platform is available in public hospital CHU. So when the teachers will use this technical platform for intervention, it is a way for those who came to learn that technique. But if there is not at the public hospital, how is that the person is going to be formed? He will do his time of internship, maybe instead of seeing 4-10 times the intervention. It may be going if he has a chance to see it once or twice, but it's not enough. So that even causes the problem of training. So the lack of equipment in hospitals not only causes the problem of daily charge, but also raises the issue of the training of health agents.
General Hospital of Korogo suffered also the horrors of war. Some houses where were staying the doctors were destroyed. Within the confines of hospital, some buildings are ruins. Despite the effort of rehabilitation of some international NGOs, the situation remains difficult for the people. This man has fallen from a motorbike at Anglais in the far north of Ivory Coast. He suffers of severe trauma. After 3 days in the coma, his parents were unable to consult a specialist in this city. He was transferred to Seacher of Korogo, the main northern city located in about 117 kilometers away. This hospital is the largest in the region. Once again, the drawback remains the problem of specialists. Fear of not traveling more than 100 kilometers to get a cosmetic surgery in Abidjan. He is forced by the situation to have surgery by that dentist. Here, he will spend less money and see his problem partly solved. He will join as soon as possible home.
I knew this hospital in 1987 with all structures, a powerful technical platform, and even what made that our neighbors came to be treated at CHR of Korogo, namely Mali, Burkina Faso and Guinea. Today my desires are to see this hospital to catch its past breath and to fulfill its role, which is the role of referral hospital.
We have therefore repositioned the lip with 2 levels of sutures, a skin suture, and after that we made a buccal level suture inside to keep the lip. Close your mouth, please, sir, close the mouth. So you see now that he has the use of the lips.
They distribute freely medicines to patients after every consultation. Patients are happy with their visit here. They take the opportunity to say their health problem in order to deal with any serious diseases.
The health service is doing a maximum, but next to that maximum, let's say that the staff is still insufficient, and especially in cardiology, there's no doctor. Really, if something was emergency requested, this would be the presence of a cardiologist.
In about 350 kilometers away, the hospital of Yamoussoukro, the political capital of Ivory Coast, does not have many specialized services. This is the case of a dialysis which is not working for some years ago. There is no support. The testimony of that patient of 63 years also is relevant. He suffers from kidney failure for several years ago. He is obliged to do his care in Abidjan. That means 240 kilometers from the political capital, in total of 4 trips per month.
I was working normally. I was relatively well until 1996. In 1996 I started to feel the burns in the legs, burning sensation of feet. I accessed through the intervention of my daughter. The doctors advised me to go to see a diabetes specialist in a hospital at Yugugon. I went there and he found the solution to diabetes. But there are those who said that there is a renal insufficiency.
Retired employee, he lives with his small pension, which largely contributes to his care. Kwame Pascal has a remarkable lifestyle that allowed him to live so far with this incurable disease. In his daily schedule, he is followed by his wife and some of his children. Every morning, Kwame takes his medicine before the breakfast. Since he is ill at his residence, every day is alike. Take medicine, take and take each day. He has no choice because he needs it to live well.
Who said terminal renal failure, said he must find the capacity to supplement the kidney, therefore replace the kidney. This is a man who lives in Yamoussoukro, but for practical reasons of availability of dialysis equipment, which remain till now confined to the CHU of Cocody, This man is obliged weekly to go twice a week to Abidjan to be dialyzed.
In its struggle for the welfare of the population, the NGO Wake Up Africa travels in Ivory Coast cities to provide assistance to the populations. Here are we again in Yamoussoukro, the political capital of Ivory Coast. Today is Saturday. Mr. Kwame go like every week in Abidjan to be dialyzed. In his fairly fragile state, he borrows every week this stretch to reach the economic capital. It is Abidjan, the economic capital. Here there are also some problems that exist within the public health centers. Some public facilities are well equipped in other sites, others have also the deficit in case of equipment. This is the case of hemodialysis center CHU Cocody. These dialysers are second-hand, meaning already used in Europe. They are exposed in this room because they are all down. They do not have a spare room. These technicians are trying to troubleshoot some rotational part of a machine to another, but it is not often obvious. Others work for a short time and are found in their initial state. In this center, patients are dialyzed in arriving orders. This young girl of 24 years old has been here since 8 a.m. It is 1 o'clock and she is still waiting for her turn.
It is not easy to travel and come for dialysis. As there is no choice, he is obliged to do so. The ideal would be that he even dialyzes in Yamoussoukro instead of traveling back and forth to dialysis. It is not recommended, but if his activities are in Yamoussoukro, he has no choice.
In view of what we see, we must highlight the most important issues of opportunities for improving the quality of work equipment for patient care, as well as the effort to provide the need for the less fortunate.
May all the prestations of health services be identical. This is the main objective of the NGO. And that all the health facilities with which we want to work be equipped, therefore have a technical platform that is adequate to enable them to make a minimum medical coverage quality. Our strategy is therefore to use the new technologies of information as the elements to achieve these objectives.
We want to use the African diaspora and the medical power to act in Africa. That is to say, in fact, that whatever is the geographical position of the current African specialists, we want to develop the structures, develop the instruments, thus by using therefore the available technical means through technology of information and communications to encourage action in Africa.
African must live, his children too, till his main road will be line crossed by this team of practitioners and specialists. The antibodies will circulate better in the body of the African people in order to give them the joy of life and to apprehend and understand the development with complete peace of mind.
Quartier latin. Eza bongo makambo ya nzambe na bana na ye. Opao, lettre A. Fallait Hippopa DiCaprio à l'oreille. Coco coco coco, fungala na kongala batama. Coco coco coco, fungala na ko fungala batama. Awali banda metiola mpe bailo mwindo mpe ya mpama te obe mwindo ya ngolo ngai ekela monzambo oyo oyo ekela vraiment ntango nani alokotanga yoyoyo yapesanga ata lipati ya suka nani alokotanga yoyoyo ata na mweshe obe moko oyanga James baninga bachelinga ye miso nzambe nanga olingo ekomi okata mosisa oya motema nanga ye oya mwana boye deception ya bolingo ekomi kotinanga na n'importe quoi na préféré na kende kokoma nanga mofuteli ata na lilita ye nyonso mponaki batela moye kukuma moye 007 Chibo Apula Onini bolingo ekomi DiCaprio lokola mayo ya esukola kelamba ata na telisi ye ekomonanga se kobwaka maongo atako na tie moto makasi nalandela matina asinga ye basengelinga moye nyonso wana po bakaunga atako na tie grudo nakota na ye tina nako badefelinga felo pitukani bleze kanimawa lobaka nanga